Hello, this is Dr. Gay from First Look MRI, and this is a 22-year-old male injured their foot playing soccer a couple days ago, I think 3 or 4 days ago. Has had continued pain in the foot, and on this axial T1 weighted sequence we see a couple things. Number one, this is the posterior tibial tendon here. It looks normal, but deep to the posterior tibial tendon. There's an area here that's gray, and this catches the eye. The spring ligament is deep to that. Part of the spring ligament is right here. It goes down, 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 and it wraps underneath the talus. This is the talus, and it actually holds up the talus. It makes a broad pouch that holds the talus up. So this is along the medial side of the talus. Now we go underneath the talus, and it goes from the calcaneus here to the navicular bone. So this is navicular, calcaneus, and it's called the calcaneo-navicular ligament, and it goes all the way from here across, making this broad pouch, and it keeps on continuing up here. And the main finding in this patient is they have a tear of it right here. Hard to appreciate on this. If we put up a T2 weighted sequence, we see fluid where we should see part of the spring ligament. So this is a component right here. Here's a fluid-filled gap, so there's a tear right there, the spring ligament. If we follow this upwards along the medial side, we can see a vertical black band here, part of it. Here's part of it. Here's part of it here. It's pretty thick right here. And you can see that posterior tibial tendon over the side. So a tear of the spring ligament, and you can see over it the navicular bone has lots of marrow edema, which is typical. If you ever see edema in the anterior inferior corner of the navicular bone right here, and you wonder why that's there, always look for that spring ligament underneath it. Sometimes you'll see a small tear. This is more of a larger tear, and there it is. So here's a fluid-filled gap, a hole within the spring ligament. Again, it makes a little saddle from the calcaneus to the navicular bone that holds up the talus. And we're going to look at this on another view here. Put up a coronal view. So the coronal view, you can see these two vertical bands. The outside one is posterior tibial tendon. The inner band is the spring ligament. This is too thick, and it wraps down around here. It looks like it may be intact right here. But if we go forward one, here's where the tear is. Let's put up a coronal view to see the same thing. Here's the vertical band here coming down where it's too thick here. Here's a nice thin band underneath. Looks more normal. And then on this view, boom, we should see that band continue down across here, and instead there's that hole in it. So a ruptured or tear or full thickness perforation of the spring ligament with an overlying marrow edema. Now one more thing about this, whenever the spring ligament tears, you get this marrow edema pattern here, and it forms a saddle that holds up the navicular bone, and when it's torn, the navicular bone can drift downwards, and it can lead to a flat foot deformity. They don't have that yet, but they're at risk. And this is something also, sometimes we see this when people have posterior tibial tendinopathy and tearing. The posterior tibial tendon will tear. This patient does not have that, but that's a classic thing to think about when you see this is, okay, is the posterior tibial tendon intact? Yes. Are the sinus tarsier ligaments intact? Yes. Because what can happen is the first domino to go is the posterior tibial tendon. When that's torn, it'll cause abnormal stress in the sinus tarsier ligaments. Then they can go into tear, and then it'll cause abnormal stress on the spring ligament. And in this case, again, it's just more of a rare isolated spring ligament tear. So thank you very much. Hope you have a great day.